the worst kind of discoloration is a melanoma. Okay, and as a dermatologist, obviously, we don't want to treat a melanoma with any of the skin lightening treatments that we do. So how do we know it's a melanoma? Well, if I'm seeing you, I'm going to take a look, and I would know if it needs a biopsy. My staff, they've been trained. If it's something that, they send me every single patient's picture before we start doing any treatment. So I look at every single one of those pictures. And we have diagnosed melanomas in our clinic. And these are just spots that are growing, and then it looks funny to me, and I say, hey, before we do your photofacial treatment, let me do a biopsy. And I have diagnosed skin cancer on patients who never thought they had, and they're so happy they came to this clinic and not just an esthetician or a plastic surgeon.
What do you do about it?
Then they'll have to have surgery. Yeah, actually, I've diagnosed skin cancer on Filipinos. Okay, so even though we do have extra protection, and technically you'd think because of our natural protection, we have darker skin, we shouldn't have skin cancer. I have diagnosed basal cell carcinoma, squamous cell carcinoma on patients with darker skin. So just be careful with that. There are a lot of treatments, potential treatments, and it's one of the main reasons patients come to see us are just, discoloration on the skin. You can even start with just skincare products, or you can do combination of treatments that are usually, if you go to a doctor, they'll say, well, they can try either exfoliating it through peels or products or microdermabrasion. There are different energy-based treatments like lasers, intense pulse light, that type of treatment that can be used. Glutathione, IV glutathione is very popular. How it works to lighten any discoloration or any area, your full body, is that it's a super antioxidant. And essentially what antioxidants are, it's our natural ability to block the bad effects of sun exposure. And say, if I go out in the sun, if I don't have antioxidants in my system, my skin's gonna darken the way it's genetically programmed to darken. So your pigmentation will also darken the way it's supposed to darken. But when you have high doses of these antioxidants, whether that be your vitamin C that you're putting on your skin, your glutathione that you're taking in the pill, your IV glutathione that you're getting through an IV, when you have high concentrations of antioxidants, you are less able to darken the skin. Okay, so that's why in the Philippines it's used to lighten the skin because they just avoid the sun altogether. But what IV glutathione does is that it takes your skin to its lightest genetic potential if you don't go out in the sun. And so if you do have discoloration, what happens with discoloration a lot of times is it recurs. So maybe it'll go away and then it'll come back. It'll come back. So we tell our patients you have to keep staying away from the sun. You have to keep avoiding the sun. And one of the things that we want to do is prevent recurrence from happening. So when you have these types of treatments, you're decreasing your risk for recurrence. Okay, but there's a lot of things that can be done. But you just have to be careful because with skin of color, we call non-Caucasian skin. I don't like skin of color, the term, but that's how it's called in the field. You have to be careful what modalities of treatment are used, because if you have too much, too aggressive, then you can have the post-inflammatory hyperpigmentation. Okay. Next. Was that good? Yes, Michelle.